Hi, my name is Dr. Anne Naclerio, and today I'm going to be talking to you about a very important topic to veterans, post-traumatic stress disorder. We're going to start with 3 stories that some of you may relate to. The first is Todd, an elite special forces operator who had a high up-tempo career in and out of dangerous places before his life began to just fall apart. He was drinking heavily, his marriage was on the rocks, and he was at a point where he was literally digging ditches. It took 7 years of his life before he understood it was PTSD. Next, I'd like you to meet Siren. She suffered a different type of trauma when she was sexually assaulted by a fellow officer in flight school. She never sought help. What if nobody believed her? She worked so hard for those wings, so she suffered alone in silence. Lastly, I'm going to share with you my story. It was December 25th in Mosul, Iraq. I was walking back from church with our new trauma surgeon, John. We had the same number of kids, the same ages. But in the blink of an eye, everything would change. A loud crashing sound, it hit so hard to my head, it would spin me to the ground. All around me was smoke, confusion. I was bleeding. Suddenly, someone grasped me, trembling fingers, palpating my pulse and hurrying me into a bunker. Others were hit, but we didn't know who. My instinct was to run and help. But I was stuck in a bed, curtains drawn, the all too familiar sound of a trauma resuscitation going on the other side. And then there was silence. I heard a voice say, "It was John." Lying on a gurney like a rerun in my head, all I could see was his kids laughing in their PJs, newly unwrapped gifts under the tree when a car would pull up, officers in dress uniforms, and a knock at the door. The pain is still so visceral, and the images so vivid of this freshly widowed spouse and the children's whose lives would be changed forever by the loss of a parent. Christmas would never be the same for them, or for me. But PTSD doesn't only affect veterans. Statistically speaking, half of you in the audience will experience a significant trauma in your life. How many of you could relate to one of the stories I just told you? But it doesn't have to be combat. Perhaps you barely escaped a forest fire or escaped death from a car accident only to have a loved one die, or were the victim of physical or sexual abuse. Perhaps you faced a pandemic causing fear, isolation, loss of loved one. Everybody who experiences trauma experiences stress, and that's normal. But in some people, the experience of stress does not subside. It persists, and we call that PTSD. Untreated, this chronic stress can wreak havoc on our body, increasing our risks for memory problems, dementia, cardiac disease, liver disease, metabolic disorders, even immune dysfunction, to name a few. Nationally, 25 million Americans will suffer from PTSD at some point in their life. 25 million adults. That's more people than live in Florida and Utah combined. Unfortunately, many will go undiagnosed and untreated, either because they didn't recognize they need help or the stigma surrounding it was so great. Too many will decide to take their own lives. A study done by the VA showed that veterans with PTSD were at least 14 times more likely to complete suicide than those without. A theme I've tried to illustrate so far is what I like to call the 4 S's. And those are silence, suffering, stigma, and suicide. These 4 interact and they exacerbate each other. But why is it that some people develop PTSD after trauma and others do not? Are those people weak? Are they less resilient? Is it all in their head? Well, if there's one thing you take away from this talk, I hope it is this. It's not just in our heads, it's in our genes. And these genes code for your biology, and that causes you to feel and react a certain way. So what can we as the healthcare team do to prevent the 4 S's? Well, consider this simple graphic to represent a timeline in a patient's life. Just with hypertension or diabetes, we want to catch PTSD and treat it as early as possible to prevent the suffering and the negative coping behaviors and long-term damage. Sadly, some will not get help until they've made a desperate gesture. Others will enter care after a divorce, loss of parental rights, DUI, something that's put them into crisis and they call a hotline. The majority, though, present near this red dot when their suffering has begun to erode their life at home and at work, and a boss or a spouse kind of forces them into care. The VA has recognized the need for earlier intervention and took action by adding PTSD surveys to all patient visits to identify veterans even before they ask for help. But imagine with me for a moment, what if we could use science to move those points of intervention even further upstream? What if a sample so small it wouldn't even fill this test tube could answer the questions we hold? What if we could tailor the treatments to the unique biology of Todd or the experiences of Siren? Well, we can. We can use the science of genomics to help us understand who's at risk even before they encounter the trauma. This opens the door for novel interventions to prevent the development of PTSD. And at TruGenomix, we're also developing novel tools to look at gene expression post-trauma in order to begin early targeted treatment aimed at the underlying biologic and physiologic problem. I wonder how Todd's trajectory would have been different if we had picked him up on a post-deployment screen. Could we have saved 5 to 7 years of his life? We believe the science of genomics can be the fifth S, which will trump all the other four. So, how is it that genomics can help? This Punnett square showing who has brown or blue eyes is what most people remember about genetics. But for most diseases, it's not this simple, nor is it this fixed. Each of us does inherit a fixed set of DNA from our parents, which we call the genome. But what gets expressed is not locked. It's nature plus nurture. So if this helix represents your genome, imagine a skin or a chemical coating over the DNA. We call this the epigenome. And as we go through life, our experiences leave marks or scars on this epigenome. And we call these epigenetic markers. I've represented them here by Band-Aids. This impacts how, what, when, and even if the genes get expressed. So when you see a veteran in your office, you see a veteran, unique, complex, individual. No two are alike. So take Todd. He's a unique puzzle made up of genomic information passed down from his parents and then impacted by his experiences, exposures, illness, could be toxins or hazards, even positive nurturing or lack thereof. Even the foods we eat can have an effect. Understanding this interaction of the genome with the environment in a specific individual is the crux of precision medicine. And our innovation is bringing the science of genomics and precision medicine to PTSD. At TruGenomix, we've identified key genomic markers that when their expression is changed causes the symptoms of PTSD. Just as in cancer care, it's time to move away from one-size-fits-all treatment for PTSD. The VA is already leading the way in precision oncology. Now TruGenomix is partnering with the VA innovation ecosystem to do the same for PTSD. Perhaps soon, all behavioral health. Let's work together using the science of genomics to move PTSD care and treatment into the 21st century and stamp out the suffering, silence, stigma, and suicide. Thanks for your time.